You are live with Dr. Chapa. Hey, good morning, good day. Whatever time you're tuning in, you know you're on the right show when you're with Dr. Chapa. Why? Because you're going to learn something. An ounce of prevention's worth a pound of cure. If the dude don't move, the dude don't groove. There's so many great Dr. Chapa-isms that are going to change and revolutionize how you think, how you act, how you play, how you pray, and this is your chance. It's your life, it's your health, it's your choice, and I want you to know that on the Dr. Chapa Wellness Show, I get very excited about people that are choosing to live better, be better, and stay better, one bite at a time. So look, every week I come to you guys and I share a message to teach you how to live your best, be your best, and stay your best day in and day out. Why? Because people don't know. I'm still shocked that people think that you can go to fast food joints and be okay. I'm even shocked that healthcare providers are still touting to be functional medicine practitioners, and they are just using the words to elude people that they are what they are, and then they find out that they're not functional at all. They are still recommending cereal to babies and puffs for babies and certain types of formulas for babies or antacids for babies. Listen, guys, there's always a better solution. Are you listening to somebody that's truly promoting no drugs, no surgery, or are you listening to somebody that says they're functional and in the end they are recommending steroids, they're recommending antibiotics, they succumb to the Tylenol when the fever starts bouncing up? People don't realize that something as simple as a fever is your body's tale that it's fighting off infection. It's not the end of the world to get sick. And I've had to come to grips with this. Living in the wellness space, I'm expected, or at least I feel or experience the pressure that I may even be putting on myself to be excellent and never be sick. So I show up to work if I feel good or if I feel bad. Thank God I feel good and great more often than I don't. But there have been times on the weekends when I have some time for my body to crash, and it does. There have been times over the course of 21 years of practice where I have indeed gotten the flu. That doesn't mean I'm an unhealthy person. It probably means I got out of balance. Well, welcome to the club. That's what I deal with ongoing. That's my personal issue. But I'm also not afraid to go at the infections and immune burdens that my body carries when it presents itself. 101 to 103 in the fever space is prime time for killing. What does that mean? That means that if you have a fever, baby got me fever, hey, don't fight it, embrace it. Take some calcium, magnesium, take some sesame seed oil, take some Thymex, take some Congoplex, rest, hydrate, put some salt in your system, go do an Epsom salt bath. You will be shocked that just those simple tricks and tools that I just threw out on the table will every time work. You can drop a fever in 15 minutes. I thought you said don't fight it, Dr. Chapa. Embrace it, Dr. Chapa, you said. No, embracing it is giving your body the resources and the tools to work with and fight back against the infection. See, Tylenol and Advil and all these over-the-counters to reduce fever are shutting off the mechanism that allows the fever to present itself. It therefore weakens your body. So at 101 to 103, when I say prime time for killing, that means your immune system is running faster and faster to strategically fight back against infection. 103 fever, your immune system is running hot, yes, and uncomfortable, absolutely, but your immune system is busy. 165 times the speed that it normally operates in order to fight off, ward off, and deal with any infectious burden that you may be dealing with, viral, parasitic, fungal, bacterial, whatever. And the reality is it's just a sign, it's just a symptom. So tonight we're going to talk about what your body might be telling you in the form of reading the signs. Oh, I love this topic. It's one of my favorites. And people don't realize how cool this stuff is. So if you have somebody you want to share this with, please do share this message, because I'm telling you it's going to revolutionize somebody's world. And I want people to live better, be better, stay better, and I need your help to get this message out so that people can feel good, live good, and perform good all the days of your life. I remember going to my first seminars. I went to it just because of the message in the title. What is your body trying to tell you? Reading the signs. You see, the body communicates. You don't need blood panels, although they're useful. You don't need anything other than a mirror and some basic understanding of what your body's trying to communicate. For example, your ears. Did you know if you got creases in your ears, what does it mean? Does anybody know? I know somebody knows. Yes, cardiovascular dysfunction. Now, but going deeper, if your crease is deeper on the left versus the right, or right versus the left, that means the side of the heart that's experiencing the weaker issue. If you ever see a patient that has died of a heart attack, in their casket, you will see creases will tell the tale that they indeed had heart disease a long time. They had some sort of vascular insufficiency a long time. And you can determine, if you can get to the both sides, you can determine which side of the heart was weaker. So when you're looking at people, look at their ears. It tells the tale. Left ear, left chambers. Right ear, right chambers. Very cool, right? So your skin, your nails, your tongue, your eyes, your face is communicating a message, but are you paying attention? And that's what I teach people to look for day in and day out. I'm shocked at the number of people that literally are going through their day and they have blatant symptoms, and they have blatant body physical shifts and changes, and they missed the sign. And today's doctor doesn't absolutely know about these underlying findings because there's no medical papers on that, or there's no blood work to support that. Come on, guys, it's more than just blood work. You are more than your blood. You are a brain, a body, tissues, organs, cells, trillions of cells, 38 trillion, some people say 88 trillion cells, strong. Well, at least you should be strong. But if you have symptom patterns you were not genetically born with, it simply means that your body is falling apart. It's aging too fast. It's not aging graceful. We want to help you get back on track with basic nutritional protocols and programs. Looking at food as medicine, we can take you off the 4 deadly foods. We can take you off the inflammatory foods, because what you eat is important. It is and will always be. It is medicine. But what you don't eat is what? More important. And I get excited to share that with people because I want you to grasp the idea that it is something that is in your control. The 4 deadly food additives, by the way, that cause a lot of these symptom patterns are things that are right around your bath, your kitchen pantry. They're on your spice rack. They're at the dinner tables at restaurants. They're everywhere. You're being inundated, and they don't even tell you what's all in the ingredients that you're purchasing. So without further ado, let's dig in. Let's see what your face might be telling you. See, the body always leaves clues. God left us a body that is orderly, not chaotic. It is going to teach you to communicate with your internal working system. You're in control here. Your body communicates long symptoms appear. I love this concept. An ounce of prevention is worth a pound of cure. You see, in the beginning, disease is hard to recognize, but easy to fix. You just got to understand that the symptom patterns are showing up as a tale, a sign to show you which way to go. In the end, disease is easy to recognize, diagnose, treat, if you will, with a medication, of course, because that's the only way insurance is going to cover it, and hard to fix because you can't fix a diagnosis with drugs. You can sure paint over the rust temporarily, but it's just a matter of time before your body begins to deteriorate and it starts getting weaker and weaker by the second. So you must pay attention to what your skin, your nails, your tongue, your eyes, your hair are telling you. These changes happen subtly and sometimes overnight. It depends on the severity of toxic burden that you are carrying. Skin, for example, right around the cheeks, when you see those little vascularities, those little seemingly wavy little veins or worms pop up in your skin, not necessarily a parasite, although it could be. I just saw something crazy today. I wish I could flash it up on the screen for you. But literally just a boil, like a large porting boil of yellow, green goo coming out of a patient's face. Well, they have a history of sinus congestion. They have a long history from the time they were a young teenager to their late 40s. They have been dealing with sinusitis at a large issue. And we've got them off of the 4 deadly or 4 inflammatory foods. And we're going to talk about these things, don't worry. And you would be shocked at the results that we're getting. This sounds terrible, right? You got this big old nasty boil pop up on a person's face and you're calling that good? Well, because if the body deemed it necessary to port that thing out, that's a sign the body was ready to deal with that infection. And that's all it was an infection. I had a patient one time come in, this was many years ago, but they had the medical profession just gave up on them. Said, there's nothing we can do for you. They had 103 fever. We don't know what to do for you. The person was weak, tired, fatigued, completely debilitated, completely dehydrated. They could have at least given them fluids, and they didn't. They just gave up on the patient, and they had obviously been down this road many times before. And it was definitely a scary situation. We're talking swollen elephantitis level legs and calves and ankles, and the body was definitely not in a good place with the amount of just body swelling. But the cheeks really told the tale, and it told me when you saw the cheeks, these red patches right on the cheekbones called rosacea. It's an indication that the blood is acidic. It's an indication that the spleen is dirty. It's an indication that the filtration and the white blood cell production are old and they're insufficient. They can't keep up with the demands. So I went straight to work. I put the patient on sesame seed oil, Thymex, which is a T-cell upregulator, and a natural killer cell booster, olive leaf extract specifically. And I told the patient, it's Friday, if your system develops a boil in the next 72 hours after this protocol that I just put together, I did not change their diet, understand at this point in time. It was a Friday, it was acute, it was just something I had to make a quick decision. And if they had a boil or a pimple or a pocket of infection pop up and it started to port, I told them, don't panic, we have a game to play. And I know this isn't a game, this is people's lives, and I take it very seriously, but this is just what I said to the patient. No word of a lie, Saturday night, boil pops up on the shin. You remember I told you, cankles, big, swollen elephantitis level legs, and the boil popped up Sunday afternoon, it ported, and I'm telling you, if not 3/4 of a cup of green, yellow, funky brown yuck came out of the dude's shin. What the heck? And I told the family to say, keep pushing, don't stop, won't stop, stay hydrated. Here's a couple more things we can do. In this case, we avoided dairy, milk, cheese, yogurt, sour cream, ice cream, whey protein, and lo and behold, boom, the body left the clue. I picked up the clue. Private eye detective over here, Dr. Chapa's in the house, and guess what? We, inside of 3 weeks, got the swelling out of the legs, we got the infection to stop porting, we got the fever under control, and the patient felt better than ever, and they started to turn around. Now, was that the end? No. We wound up doing 4 rounds of sequential immune boosting protocols to help the body deal with staph, strep, virus, parasites, and we then finished it off with a lymphatic wash. So very fascinating protocol, 5 months long of work and lifestyle changes and diet, and we got the body to shift and move and groove. And all the while, it started with just one, the fever kind of gave off some clues that they had an infection. The blood work showed that they had some infection, but you could see this rosacea all around their cheeks. I knew it was spleen, and sure enough, the white blood cell count was too low, couldn't fight the infection and support it. The body with just basic foods and some removals of inflammatory foods, and bam, home run city. That's the cheeks, right? So how would I have known that other than I've seen it dozens and dozens of times? I've also seen rosacea respond to food grade vitamin C, not ascorbic acid, not 500,000 milligrams of ascorbic acid, not biobuffered C, not bioflavonoids. I'm talking full complex vitamins P, K, and J, tyrosinase, cofactors, flavonoids, bioflavonoids, ascorbic acid, all those things compacted together in real food. Foods like rutin. Who goes around and eating rutin? Well, it is a rich source of vitamin C. Of course, citrus. Always brings me to the story of the lady that was back in the horse and carriage buggy days where doctors would come by the house and fix up the family. Well, they showed up at this house, doctor does, on the horse and buggy, comes in, checks the kid. Oh, he's got rheumatic fever. I'm sorry, ma'am, he's going to be dead by morning. There's nothing I can do. What? Well, Mom, are you sure, Doc? Are you sure? And the doctor said, there's nothing I can do. I'll be back. I'll stay at the inn. I'll be back first thing, and I'll help you with the arrangements of your son's passing. It's a very sad moment, and the doctor leaves. Mom is scratching her head, not quite sure what to do, and then it dawns on her. My grandma told me when no one knows what to do and unsure, go get as much in the form of lemons and limes and oranges and citrus as possible and start dripping the constant IV, if you will. So like the first indicator of an IV drip, but it was all manually done with citrus, and you would see a miracle happen. 3:30 in the morning, the mom sends out her boys to get all the lemons and limes and oranges that they could get. They started dripping oranges, limes, and lemons into the boy's mouth that had rheumatic fever, who was on ice, and they're trying to control the fever, and nothing was working. And within 3 hours, 6 a.m., all of a sudden, the boy's fever broke. Then, by 8, when the doctor showed up, the boy was not dead. The boy was ravishly eating breakfast out of the ice, ready to go. The fever broke. Hunger came back on, boy starts eating, hydrating, and turned his world around. How did that happen? Because when you use real food, when you use the real complexes of vitamins, minerals, essential fats, you get real results. This is powerful. Doctor says, this is a miracle. I can't believe this. What did you do for this boy? Mom told her the same story I just told you about Grandma. Grandma said, drip the citrus in the mouth all night long and the fever will break. Just give it time. And doctor goes, I've heard of people doing that in the past. And the mom looks at the doctor and says, but you said there was nothing more that could be done. What do you mean you've heard of this? You said there was nothing more that could be done. This was my son's life. And when the doctor says, well, there's no scientific papers on that. Come on, dude. Life or death, and you're worried about science? Pull every punch you can. Find a solution. My goodness. I would be absolutely devastated, because what if that young boy went on to change hundreds of thousands of people's lives? What if that young boy became the president's father one day? What if that boy influenced a generation for the better? And I bet he did. I don't know. I didn't follow that part of the story. They didn't talk about it, but changes are everywhere. Your fingernails. I know I could talk forever about this stuff. I get excited, sorry. But I'm not sorry. This is exciting. It's exciting. The body keeps the score. The body leaves the clue. God created order, not chaos. This is beautiful news for you, for me, for us. Anything your body can develop, please get this, you can undevelop. So the creases can go away. The cheekies being all red and broken out can go away. We're talking about your body leaving clues. So when you look at your fingernails, if they are cracked and brittle, that's a mineral deficiency. If they are literally pale, it's a thyroid deficiency. If you look at them and there's no redness in the nail bed at all, it's just one pale colored nail, again, that's endocrine thyroid metabolic issues. So if you see that, know that your body's already communicating. If you see these are called lunulae at the base of the nail beds. If the thumbs are lunulae less, meaning there's no moon at the base of the thumb, it means your brain and major exit channels are dysfunctional. You're not getting circulation to your brain and major exit channels. So we would come in and try to fix that, correct that, strengthen that area of circulation. We use balancing calcium and phosphorus and magnesium, making sure that they're on your blood work in a 10-4-2 ratio. When we look at the body wants to be served. The brain needs two things. It needs stimulation and fuel. So we would increase blood flow to the brain. We would decrease inflammation as rapidly as possible. We would balance the blood sugar, maximize the lymphatic flow, strengthen the liver, and detox the bowel. Wow. That would be a miracle for just something such as nail beds and seeing those improve. People go, there's no way that means anything. Moving on. This is brain and major exit channels, liver, gallbladder, and how many people come in to see me that they don't have a bowel problem, they got a liver problem. The liver's the giver. The gallbladder gets clogged up, the liver backs up. It's got 1,700 jobs to do day in and day out, and no one's teaching you to detox except for me. I'm teaching people that detox is a must. It has to happen. It's 21 years, 42 days a year, you should be detoxing. I've done 51 detoxes, 32 gallbladder flushes, over 100 enemas. I've done all kinds of parasite cleanses, lymphatic washes, neural pathway cleansing, and kidney cleansing. You name it, it can be cleansed. get excited that what your body can develop, it can undevelop. You just got to get with somebody that knows what the heck they're doing. And this is where we get involved in seeing those lunulae come back on the nail beds. If they're missing on your middle fingers, it's cardiovascular dysfunction. Did you know there's cardiovascular cleanses as well? I've done a gazillions of them. Why? Well, one, I'm curious about heart disease because remember, my dad died of a heart attack in my arms when I was 19. It's woke me up. And so I want to strengthen my heart. I want to boost the energy in my heart. I was literally doing a heart sound recorder on a gal the other day who's been having PVCs, has been feeling her heart rhythm out of balance in her chest, and it freaks her out. We're doing this heart sound test, and we literally see it on the tricuspid valve. And she goes, at the end of the test, she goes, I felt the PVC during that. And I said, let me show you where it is. I saw it too. And I just spun it over there, showed her on the clip, and she goes, wow. That's amazing. What's more amazing is we can help her fix that. Why? Because the body gets dibs on all nutrition. So cardiovascular cleansing and nutrition for the heart is B vitamins, minerals, potassium, making sure the electrical pathways and other water-soluble B vitamins are in check to make sure that the SA node and AV node are kicking and firing. You see, your heart fires because it's told to, not because it wants to. That's interesting. And it gets first dibs on all nutrition because if your heart goes, you're dead in the water, man. Your brain will starve in a flash. Your system will shut down because blood flow is everything. That's why God called it your lifeblood. Take care of it. So when you see the cheeks messed up and the white blood cells dysfunctional and the spleen clogged up, there's acidity happening inside of your blood. Now your ring fingers are your hormones. This is going to be pituitary, thyroid, adrenal, gonadal system. And if there was a class I just taught this past week, and we were talking about the most important place to start. Digestion. The second most important place to start is endocrine. When the endocrine system is rocking and rolling, when you're feeling your best is when your endocrine system is performing its best. Hormonally is producing the hormones that it needs to produce at the rate they need to produce them day in and day out, not missing a beat. Boom, shakalaka. So if you're missing ring finger moons, guess what? That means that your endocrine system is weak. It needs to be strengthened. And I'll be honest with you, with stress, I've had mine go away. I've had mine come back. I've had mine go away. I've had mine come back. So you can get these things to come and go, but you've got to know that your stress plays a big part, sleep plays a big part, your recovery plays a big part in endocrine function modalities. If your pinky is missing the moon, it means the thyroid is weak. It means the thyroid is not performing well. It means that your body needs nutrients to fire and push the system along. I know I'm sitting on this slide a long time, guys, but there's so much that the fingernails, the ears, and the cheeks give us in the form of resources and tools. When you look at the tongue, we already kind of went through the nails, smooth nails, strong nails, every color nail bed, and we'll go to the tongue in a second. But when you see the different dysfunctional nail patterns, these are mineral and B vitamin deficiencies. This brittle white one at the front, that's not just brittle, that's also fungal. And so when you see that type of pattern and dysfunction, that is an indicator that the mineral levels are low, B vitamins are low, yeast is high, and we've got to get that under control quick, fast, and a hurry, because it means you're aging faster than you're supposed to be. And we don't want that for you or your family. So we want to encourage that to be better. So what does your tongue really reveal? Well, your tongue reveals digestive health. This is truly the window into the soul. If your gut lining is inflamed, it will show up in your tongue. I had a young lady come in this past week, and she's, 15 years old, and across the tip of the tongue, the deep V, all the papillae are literally swole up. They're poking off, and it's like they're reaching for something, right? They call it the strawberry patch tongue. And it's a classic indication that the patient is lacking specific B vitamins for their heart, B4 being one of them. Well, before is also called BIOS, B-I-O-S, and it's called the life vitamin. So we would go after that. Well, what if you're a methylation case and you don't methylate well? We just use something that had methylated Bs and probably increase your B1 intake and maximize the liver's ability to keep up with detox so that you don't burn out all your B vitamins. A lot of times I'll put people on B vitamins and the pee will turn yellow. They freak out. I'm peeing out all my Bs. No, you're not. You're detoxing, and you're detoxing minerals and B vitamins out with the toxins because your body isn't going to willy-nilly just let toxins float out of the body. Aluminum, cadmium, heavy chemicals. I had a patient that had just mopped their floors or shampooed their carpets and their dog got sick. They had allergies. They were feeling fatigued and worn out and run down, and it was a sign that their body was toxically more burdened than it could be. Well, when the body is dealing with those toxins, it is using minerals at a high level and B vitamins at a high level. Good to know, right? So when your tongue is a healthy pink color, it's healthy. When you have that deep ravine down the middle of that tongue, so go look at your tongue right now. If you have a deep ravine down the middle, it means that the digestive system is aggravated. You've got potential inflammation in the whole gut lining, in the muscular tissue, and you're not getting good what we call peristalsis. Well, how many people come into me and they are genuinely constipated? They are missing bowel movements. They're not pooping on time. Everything matters. A healthy tongue dictates what's going on in the digestion. If you see, and not in this picture, but ridging on the edge of the tongue, like the teeth imprints, that's an indication that the liver is backed up. The tongue is actually swollen, and it's swollen full of toxins. If you see white coating over the tongue, that's yeast overgrowth. My goodness gracious. I can even take the top lip and pull it up and out and show you the frenulum, and if there's a frenular cyst, a pocket, an extra hanging piece of skin on that thin skin right between your tongue and your gum, that's an indication that you have a pocket of inflammation, otherwise known as a cyst in the gut lining. Closer to the gum line means higher in the gut. Closer to the lip line means lower in the gut. So we want to be paying attention to what the tongue looks like. You want an even texture, you want it nice and moist, and you want it healthy and pink. You don't want it swollen, red. You don't want a geographic tongue that you look in there and go, wow, that looks like a continent. You don't want that. Those are all indications that the body is screaming for help. When they do iridology and they look at the eyes, if you see in this case right here, this patient has this little shadow at the base of the color part of her eye. So just directly south of the pupil, you'll see a shadowing, a triangular shadow in the base. Classic indication that there's an adrenal insufficiency. It could be stomach if you look at the 3 o'clock position. It could be spleen at the lower left 8 o'clock position. You will be shocked that your body is constantly communicating. Are you paying attention? Do you know what you're looking for? I had a case where the pupils were just constantly dilated all the time. It was all thyroid case. So I just started discovering and researching the thicker the pupils, the weaker the adrenals, the weaker the thyroid. If a person has a weak endocrine system, pituitary, pineal, thyroid, adrenals, gonadal system, if it's weak, you're dead in the water. You don't have the ability to make hormones. Your system is going to gain weight. You're going to be more infected. You're going to have more health challenges. If your eyes are simply dry, that's non-infectious allergy. The ducts could be clogged up. The moisture membranes, the mucous membranes aren't producing because they're not supplying the right nutrients, like vitamin A, for example, huge. Vitamin E, for example, huge to strengthen our eyes. And then you're constantly using wetting drops. If you're pale, if your eyes in the sclera, the white parts, are all red, or that's an indication that they're looking for oxygen. The eyes are acidic. The eyes are carrying infection. And the infection is in that case winning because it's starting to streak in the sclera of the eye. The same in the tympanic membrane of the ears when we get there. The yellowing of the whites of the eye, that's an indication that the liver can't keep up. Really, Dr. Chapa, all this and more, guys, all this and more symptoms are popping up left, right, and Sunday, and you've got to come in and let us work on you so that we can teach you why your body's breaking down and what you can do to deal with it. Your skin is everything. If it's lush and beautiful and radiant, then your essential fatty acids are fine. If it's dry and cracked and irritable looking, you either have an infection or you have a imbalance in minerals and essential fatty acids. Guy walks up to me at an event. I'm talking to him. This is just a week and a half ago. I go to and do some networking at this place, and he starts talking about this pain that he had under his right shoulder blade. He starts telling me that it just showed up real quick, fast, in a hurry. He had no rhyme, no reason. He's a pretty rambunctious fella. He mows grass, tractors, things of that nature, farming type activity, acres of land, right? So we could have blamed it on dehydration. We could have blamed it on lymphatics. And really, that's what I blamed it on. I said, well, tell me more about it. Did you do anything? Did you eat anything weird? No, I swear. Well, I'm sitting here listening to his story, and after a couple days, it started to move, and it started to travel from the right shoulder blade down through the right rib, down underneath the right upper abdominal region. That's an indication of lymphatic flow. It started to break up here and drain down. That's what it should have done in the first place, but it didn't. So that would be a slow wound healing. His body got an infection, it couldn't clear it, and it was backing up. But it took it 4 days for his body to figure out how to fix it. I'm pretty sure he did a steroid. I'm pretty sure he did an antibiotic. He didn't want to admit it, but I just kind of gathered. But I said, look, this is one other thing I'm paying attention to. One, sudden randomized pain that just shows up out of the blue is typically lymphatic. Pain that moves back and forth, side of the body, knees, elbows, shoulders, hips, and you can't keep up with its rotational pattern. Moving pain is lymphatic pain. That means there's infections hiding in your lymph system. And then I said, and one other thing, bro, I looked at his face. I said, I'm not trying to pick on you, but the right side of your face is all pimply. The left side is not. Why? Because the lymphatics drain left to right, top to bottom, back to front, and it's going towards that right-sided liver where your liver resides in order to be processed out effectively. But it was all backing up into these tissues. And the body doesn't want your sinuses backed up, your eyes infected, your brain affected, so it's going to put it in the next location, shoulder blade. So what do we know about shoulder blade? It's gallbladder, it's liver. So we look at interesting finding. He was really mind-boggled. If you're a slow healer or bruise easily, that's an indication of nutritional deficiencies. It could be iron, sure, it could be. But we would ask you questions. Are you on a period? Have you had any major injuries? Have you been at the hospital lately, right? But if you're a slow healer or bruise easily, you already know it. You can't bump into stuff, or you wake up with random bumps, bruises, and irritations, and your body is doing the best that it can to function. That could be another vitamin C deficiency. That could be another vascular issue that needs to be addressed at the collagen level. So we may use straight collagen in that case. We may use some fish oils and essential fatty acids. We may use some vitamin A or vitamin E to repair the skin at the rudimentary level and then get you off the mucus forming inflammatory foods like milk, cheese, yogurt, sour cream, ice cream, whey protein, and watch the magic start to happen. It's fascinating. Frequent irritation on the skin. You touch anything and it blows up. That's a high level histaminic response. Hyperactivity in the histamine department means that you have imbalance in your lymphatics, minerals, and your bowels. We flush the bowels, flush the liver, flush the lymphatics. We boost up your B vitamins and mineral manufacturing facilities. Boom, this stuff goes away. The irritations are more tolerable. You can rub your skin, you can handle abrasions, and things don't typically wreck you. Right? So looking at your lips, if you got cracks in the corners of the lips, that's a calcium, magnesium, and essential fatty acid deficiency, typically caused by an underlying viral issue. How do you know all this? I've seen it tens of thousands of times in the office. It's crazy. This is not hard stuff for me. This is something that you need somebody to help you understand why your body's breaking down and what you can do to fix it. This is what I do for a living every day, and it's a gift. I love this work. I love working with people. I love seeing people win, and I want to see you win. I want to see your family win. So send them in. Go to justlivewell.com. Go to drchapawellness.com. Get enrolled in our wellness programs. I'm telling you, you will not regret it. You will love how you feel, and your body will perform better, better, and better each and every day, every month, every year. You will thrive on the Dr. Chapa Wellness program. So hair issues, changes in hair structure. If you are shedding hair, you have a yeast problem. Male hormone balding. Women that have hair just excessively falling out is a B vitamin, fat-soluble B vitamin family, and yeast issue. What's happening is biotin is getting used up to fight back against yeast. So we've got to change your diet pretty aggressively here. We might even have to do a mold detox, a fungal detox, and definitely a yeast detox. Get your minerals up and your B vitamins up again. Why? B vitamins and minerals drive everything, folks. And so if you don't realize how important this mineral game is, you're always going to be behind the 8 ball wishing your hair would thrive, and it can. I always tell the ladies, if you want luscious, beautiful skin, wonderful flowing hair, skinned hair, and beautiful, strong nails, you got to get strong minerals and strong essential fats all day, every day. The hair is a burden of yeast because what's happening is the body is trying to fight back against yeast converting into myocyl hyphae, a more aggressive form of yeast, and your body loses or throws all of its biotin, which is in your hair follicles, at the myocyl hyphae to convert it back into a simple yeast. Well, that's why you see biotin so effective. It stops the yeast from turning into that more aggressive form, and the body's not having to use its own reserve. Whew, man, that's a lot to look at in just the hair story. So essential fatty acids like fish oils, tuna omega, omega-4s, huge impacts. Go to shop.justliveoil.com. Our cod liver oil and tuna are great here, but then we start looking at yeast protocols. How do we fix that? Yeast force, one of my favorites, but don't do much, just a little. Mineral force, do a lot, and make sure that the bowels are moving well every day, and you will get lots of shine instead of a loss of shine. You see, when the hair is healthy and vascular, when the body is not toxic and using the hair as a trash can, it shines. When the hair is fragile, cracked, brittle, and lost its luster, it's because it's full of junk. And that's why it starts to break off, because there's no life in it. Brittle. That is an indication of a nutritional deficiency. Could it be cortisol induced and hormonal change? Of course it can, but a lot of times it's infection from yeast that's weakening the immune system, creating more hormonal stress in the body because there's no B vitamins and no minerals. You see how all this plays back? And I know you're saying just minerals, Dr. Chapa. Go get some mineral force, get some of my salt, get some of the omega force, get my B vitamin energy force or my methyl B force, and guess what happens? You will see these tissues turn back on without you doing much of anything. You see, you shouldn't have to go after everything. You should just be able to supply the body with the right resources, vitamins, minerals, essential fatty acids, and boom, shakalaka, the body does exactly what it's supposed to do. It's beautiful. So this is your body telling the tale. Nutrition matters. What you eat matters, but what you don't eat is more important. If you're eating high fructose corn syrup foods, you're inflamed. If you're eating partially hydrogenated oils, you're inflamed. If you're eating artificial sugars like saccharin, the pink stuff, Splenda, the yellow stuff, and or aspartame, the blue stuff, you are poisoning your brain. Please don't do that. If you're getting into monosodium glutamate, you are stressing out every neural pathway in your body. These are high contaminant foods that are not here to serve. Red dyes destroy your system. So when you look at your body in the form of the 4 deadly food additives, with the 5th being the dyes, we know these got to come out of our system, our diet. We can't keep putting them in because it's wrecking your mineral balance, your B vitamin balance, and stressing your liver, stressing your hormones, stressing your lymphatics, and causing your body to malfunction. Dairy, grains, soy, corn, the worst foods you could be consuming. I want you to eat real food. Everything in this picture could be consumed and feel good about it every day, twice a day, 3 times a day, 4 times a day, and you would thrive. It would give you the balance of healthy fats and protein. It would give you the balance of minerals like zinc and iron and magnesium, which we've done many talks on calcium and magnesium just in the last few weeks. If you've heard any of my blood work talks, you'll see that I talk about ferritin and all the red blood cell differential, because I want to show you where and why your red blood cells are weak and fragile and breaking down. And then I'm going to teach you about vitamin, minerals, and essential fatty acid balance, maximizing your nutritional status. What you eat is important, but what you don't eat is what? Somebody put in the chat, more important. We have a great guide that you can get in order to learn more about these tools and resources. Just put nutrition in the comments below and we'll send it to you. It's a cool little book I put together, and I'd love to make sure that you get access to this information. It'll change your life, guys. Actually, I got about 15 little cheat sheet books, and we'll be playing Easter egg games over the year to continue giving you all of this great data to teach your body how to strengthen every pillar of good health, from your gut to your brain, from your nose to your toes. Every which way to Sunday, we're going to make you stronger, vibrant, and make you well again. Vibrant and energetic again. Visible signs alone sometimes don't give us all the stories, and this is why we still do a healthy history, we do a healthy physical exam, and we do a strong laboratory push to make sure that we can see where your body's breaking down and what else is driving root cause issues in your body. Don't underestimate that just because I'm making all these assessments and reading the signs with your body that I don't look at blood work. I look at blood work deeply. I learn more about blood work each and every week. When I look at it, I can review it and basically talk about it, talk to it, show people the befores and the afters, and show them progress and show them where they still got work to do. And it's okay if you still got work to do. We're all on this root cause journey. Appropriate testing matters. If you're not getting your blood tested once or twice a year with me, then you may not be running enough of the right blood panels. I want you to get the right blood panels. I want to look at and show you where your body's breaking down, and blood work shows me those resources. Healthy habits always support a healthy cell structure. Remember, there's 38 trillion cells in your body. Some people say there's 88 trillion. I don't know who's counting, but trillion is a lot of cells. 38 trillion is a lot more cells. I want to feed those babies right, and I want to feed them with real food, and I want to encourage you to do the same. Healthy cells, daily habits make the difference. When you eat real food, when you stay hydrated, when you prioritize sleep, manage your stress, and stay active, you're going to see your body thrive in every area, but specifically your skin, your hair, and your nails. People are going to see you and go, man, you look like you're 10 years younger than you are. And you're going to be like, well, thank you. Praise the Lord. Glory to God. Thank you, Jesus. And you're going to give glory to God because you know where your real help comes from. I call that vitamin J, Jesus. And we wrap that up in vitamin G, gratitude. And we wrap that up into vitamin A, abundance. And we have the abundance that comes through following the Lord. Love, joy, peace, patience, goodness, faithfulness, gentleness, kindness, and self-control. Makes me excited just looking and thinking through how health matters and how health influences us spiritually. Clearly, I can talk about this stuff for hours, but we're moving to the end of our show tonight, and we'll be back next week. Don't worry. I'm excited to bring you a new and exciting show each and every week. We have our Design to Thrive Masters class. Pull out your phones, scan that register QR code. You will be able to get expert insights, practical strategy on how to live better, be better, stay better, and then discover that better health is right around the corner. So take out your cell phones, make sure that QR code works. I hope it does. Let's see. I'm going to do it on my phone just for fun. Yep, sure takes me to it. Boom, shakalaka. Join Dr. Chapa for this free and awesome masterclass. Learn how to detox your body, renew your mind, and restore life one bite at a time, baby. So guys, this stuff works. We are a true blue functional medicine practice, medical metabolic health practice, hormone balancing practice, healthy aging practice, faith and wellness. Why? Because the healthier you are in your body, the more spiritually sound you will be naturally, because it's easier to see and hear in the supernatural, I believe, when your body isn't suffering with migraines, blood pressure problems, and or body pain, right? This is a real practical strategy, lifestyle movement that I've created that I want people to tap into. Pay attention. Your body deserves it. The body is constantly giving you the clues. Nourish your body. Seek professional guidance from our office, justlivewell.com, drchapawellness.com. Call our office 281-554-8600. We have all kinds of tools to teach you why your body's breaking down and to show you what you can do to fix it. Okay? Follow us for more of these awesome details. Check out our websites. Check out our world on all the social media platforms. We're constantly trying to inspire you and shake you up so that you will live your best, stay your best, be your best each and every day. So share this message with a friend, a family member, a loved one, somebody in your world that needs this message. I'm excited to be here with you. I can't wait to see you in the next episode. Peace out, brother, sister, everyone.